This year, we'd like to shift the focus to finding solutions and exploring options to improve opportunities for both those researching and dealing with rare diseases. In this first webinar, we're going to revisit some of the themes from last year, but also try to look to the future, asking who needs to be brought into this conversation.
But how would we know how many people are undiagnosed? And we might have an idea from genetics, which is to say that there are databases that list variants, which are potential mutations, and one can estimate how many times, for example, for recessive disease, some of the pathogenic mutations will come together to cause a rare disease. And it's always true that the estimates based on those genetic variants are much greater than the actual number of people who are diagnosed. So it's clear that we're not coming even close to diagnosing all the individuals who have rare diseases, at least rare genetic diseases.
Because for a lot of rare diseases, especially where they're new, we don't know what all the symptoms are. And so our goal with being able to have patients start to collect data is actually to do an initial characterization. And this enables us also to address undiagnosed patients because they can start to categorize and catalog what symptoms they're experiencing so that we build a body of data on the road to diagnosis.
At a European level, we have been working for a number of years now on the development of what we are calling European reference networks. So what we have developed through the European Commission is a sort of a hub and spoke model. So we have a hub where we have 24 different disease areas. So say, for example, an expertise center on liver or an expertise center on the heart or the skin, or in my case, the eye, et cetera. 24 different networks. And they have a hub somewhere in a European healthcare setting, in a hospital setting. And then they have a spoke system coming from that where, centers around Europe who fit and reach a specific criteria set by the European Commission and with collaboration of member states and experts in those states in specific areas, they have to reach a criteria for membership of a European reference network. And that European reference network is really to allow for better diagnostics, among other things. So for example, in its 5 years currently in operation, it's developing, it's very much in its infancy yet. But the ambition is that we will use databases, centralized systems, so that if somebody walks into a hospital in Ghent, for example, in Belgium, with a very unusual condition, that clinician in that center is linked into a European center and can connect through that CPMS system in to see, we have that, this is the expert in this area, and this is somebody that I can refer to. I'm sure you know what I mean. It's a case of finding ways where the expertise can travel and not necessarily the patient, so we can speed up the diagnostic journey.
Sometimes they're seen as a collection of symptoms rather than as a whole or as a person, as a family unit. And we really do need to view things a little bit more holistically to be more effective overall, and hopefully not waste as many resources, especially time. Because and I'm sure others can speak to this as well, but I feel like in our country, we're very fortunate that people, there's not as much societal shaming or shunning as there are in some of our colleagues' countries, where there's a great deal of fear and isolation, more so than there even is here. And so it absolutely breaks my heart. But, for rare disease patients in Africa, for example, they've been stoned because of the fact that they don't have a diagnosis, or that they have a rare diagnosis that's intimidating. So the more knowledge, the more insight, the more light we can shed on these diseases, the more acceptance I think there is, even if there isn't a treatment. At the very least, there is some humanity and some validation in that.